right, welcome in, you guys. Welcome, official. Welcome in. We are so excited to have you guys here. I know you guys are filtering in on Zoom, and we are super excited to have you on Zoom. Speaking of that, please try to get on Zoom because we're doing something extra special tonight for the last part of our session that you won't want to miss, and you can only do it if you're here on Zoom with us. So if you're on Zoom, we're super excited. Oh, hi, RJ's in the house. What's up, RJ? Super excited. Okay, you guys, welcome in. And I think we got the doorbell fixed, so you shouldn't hear that anymore. So officially, make sure we're on Facebook. If you're on Facebook, put #live. And if you're on Zoom, we see you and we're so happy you're here. So we do have one more minute to go before we are officially live. I'm going to go ahead and grab our slides so that we are ready and officially ready to go. So hi, Tori. Tori's on Zoom with us. Welcome in, LC in the house. What's up, Leslie? What's up, Nagi David Jane in the house? Yes, definitely jump on Zoom with us for sure. And officially, it is now time to get started. So welcome in to the 3-day EKG challenge. So excited to have you guys here because we have not done this in this format before, okay? So this is a new format for us. And the exciting part about this is that we have a workbook for you. So if you didn't get a chance to get a workbook, go ahead and just type workbook in the chat and we'll make sure to get that to you because we're gonna use the workbook for the hands-on session tonight. Okay, so yeah, go ahead and put #workbook. Looks like Megan needs workbook, no problem. Tori will gladly hook you up, but welcome in. So guys, this is a class that is brought to you by you because this is literally a class you've been asking for months. You've all come to me at one point or another in the private message and said, hey, Jen, listen, I don't really know how to say this, but I'm still stuck on the P wave. And you know what? That's okay, right? Because we want you to win and we are on your team. And so speaking of your team, I want to officially introduce myself and my coach, Michelle, my co-hostess of the 3-day EKG challenge. So a lot of you probably met her when we were logging on Zoom, but Michelle is a long-standing nurse, 36 years of experience. So just a little bit. We're going to record this part. So just a little bit of experience. And she will tell you a little bit more about herself in a minute. But she's going to be our co-hostess for tonight. And she is a wonderful, not only instructor, but cheerleader. So please don't hesitate, especially when you're in your breakout sessions, to ask her questions. She absolutely loves it. And the great news is that there is no dumb questions. So you are in for a treat tonight. We are going to do a basic EKG review, including reviewing the waves tonight, the paper, and all the good terminology. Okay, so and then I'm on the left here. I'm your other coach, Jen. And I'm the one who invited you here. So if you came across an ad on Facebook and you were like, hey, I want to see what this is about, that was me inviting you here. So officially, thank you for coming. I promise you will not be disappointed. A lot of you have been through other challenges we've done before. So hopefully you can type in the chat if they are in for a treat. So they'll know for sure that this is time well spent. So Michelle, are you able to come off mute and maybe introduce yourself before we get kicking off here?
I can. Can you hear me all right?
Yeah.
Yes. My name is Michelle, and yes, I've had 36 years of experience, as Jen says. I probably started when I was like, I don't know, what, 10, 11 years old, something like that, in the ICU. Trauma unit. I live in San Antonio, Texas. All my nursing experience has been here in the city, and I've done trauma, transplants, ventricular assist device. As everybody knows, that's my love. If you say the word ECMO to me, I'm like, what? So I like all the things, and I was a clinical consultant with Abiomed and did trials with Impella. So that's kind of my background, and now I teach with Jennifer. And I still work a little bit with special needs kids at a children's shelter here in San Antonio and some little pop-up ERs. So that's me.
Awesome, Michelle. Well, thank you for being here with us. And you're going to get to interact with Michelle at the end of the class. It's going to be about half an hour where we're going to do some just general class. And Lisa's in the house. Hey, Lisa. And then we're also going to jump at the end of class into breakout sessions where we can work with you a little bit more intimately And we're also going to be, for that part, we're not going to be recorded. Megan's in the house too. Coach Megan's here. Oh my gosh, everybody's here. This is awesome. So Coach Megan in the Zoom or Facebook chat, Coach Megan is our cardiology queen. She's a nurse practitioner, and she'll be joining us from time to time to help out as well. So as you can see, we have an amazing team that's here in the chat and on screen ready to help you succeed. So let's talk about how this class is going to work. So first of all, we're going to spend 3 nights. Yay, Carl, you're here. What's up, Carl? So we're going to spend 3 nights together starting tonight, where we're going to kind of dust off the cobwebs, and we're going to get really comfortable with the waves and just the very basics. Hi, Erica. Hi, Espree. Welcome in, ladies. So nice to see you. And you can join the classes on Facebook as you're doing now, but for the end part, we really need you to hop on Zoom, because that part we're going to put you into breakout sessions, and we're going to just do 2 groups, smaller groups, and we're going to work with you with the workbook. So also on that note, if you're just joining us, if you haven't printed the workbook out, go ahead and get that printed out, because we will be doing a hands-on workbook with you tonight. Okay, so this is what it looks like, and if you need it, put hashtag workbook either on Zoom or Facebook, and Tori will get that out to you right away. Now, are there prizes? Yes, actually, we're going to give away a prize every night. So that's the really cool thing. That's just the bonus. That's the icing on the cake. The real prize is the actual knowledge, but we are going to give away actual prizes to people who show up live. And the reason we do that is because we really want you to come live so you can have the experience of getting to interact with us if you want to, but there's nobody that's going to be put on the spot. Don't worry. We just want you to have a chance to ask questions. Okay, so I'm officially now introducing myself. This is me lecturing on the road. This is me working in the emergency department. And of course, this is me working in cardiology. So my name is Jen Carlquist. I've been a PA for 14 years. I was a paramedic for 13 years prior to that. And I really enjoy, obviously, the teaching component the most. You can see I'm smiling the biggest in there, although I love all my jobs. But what I've done is I've had a chance to see a lot of cases, see a lot of things, and really kind of look back and figure out how I got here so that I could help other people come along with me. Oh, yay, yay, RP. So excited. Yay. Okay, so I do want to just reassure you, though, that it wasn't always rainbows and butterflies. And I say this in all humility because I want you to understand that even though, yes, we're here, we're in this great class, and we're going to teach you a lot. And I look fairly confident here. This is me as a medic, right? As a baby medic, you can see. Really, I was terrified of EKGs. That was the thing that I really thought was going to stop me in my tracks and wasn't going to allow me to proceed on. All right. And so that was my Achilles heel. And I really know that this to be true, that it is really a lot of people's Achilles heel. And so usually we do a 5-day EKG challenge. So we shortened it down to 3 days because we know that you're busy. We know you want to get in and get out and get the knowledge, but we also know that we need to keep it short and snappy and interactive, because that's really the way to learn, right? You don't learn from just watching the screen. You learn from actually going hands-on and doing something tactile, because none of us are just visual learners or just auditory learners. A lot of us have to take that knowledge and keep applying it. Okay, so we're going to do that tonight. Now, the 3 tools that you need to succeed in EKG land, and I figured this out the hard way, is mindset, skill set, and tool set. And what do I mean by that? And why would I talk about this at the very beginning of our challenge? Well, here's why. When I got done trying to learn EKGs in paramedic school, I know I was so young, Espree. I literally was like a broken, I was just like a broken flower. I just felt like I was never going to get it, like I wasn't good enough, and like I wasn't smart enough. Okay. And I know a lot of you feel that way too. So with that being said, there's a bomber airplane, I'm sure, going over us right now. But with that being said, the next thing you need to do is realize that, you know what, if I can do it, so can you. And we need to take the mindset piece that it's not that you're the broken flower, it's that our system is broken. It's the way we teach it. And really, I do believe that, okay? We shouldn't teach people access right off the bat. That is a way to scare people, or vectors. That's a way to terrify people into running away. We should make it easy and palatable, which we're going to try to do tonight. We also need a skill set. And the skill set is actually knowing how to spot the bad things and how to really identify normal. So we'll talk about normal today and the next couple of days, so you have a frame of reference. Okay. And then lastly, we need tools. And so we'll be giving away one of those tools tonight. I don't want to spoil it, but I'll show you a little bit later what I'm talking about. Okay. So what I want to do is I want to take a second now for you guys to tell me in the chat. I want you to tell me what part of EKGs is your Achilles heel, because I know we all have one. Some people it's bundles, some people it's axis, some people it's heart blocks. Those are the most common, I find. And so don't hesitate to type in the chat what your Achilles heel is. I'd love to hear that from you, whether you're on Zoom or Facebook, just to hear from you. Okay, yeah, understanding 12 leads, all of it. Yeah, see, what you're gonna see is you're not alone. Okay, Maria says all of it. Yeah, and that's okay, right? So bundles, yeah, everybody. So at the end of the day, right, we have a lot of things that are confusing. So let's go back and go talk about the basics so that we can build on that from here. So how do you get really good? First of all, not getting overwhelmed. Second of all, spending any little time, any precious time you have with learning EKGs, spending it on focusing on the things that will kill somebody, okay? Focusing on those things. And practice, yeah, that's true, right? We have to keep our knowledge fresh. Erica says heart blocks, yeah, for sure. And then it's good to have some guided practice. So taking the little time you have, focusing on those things that will kill your patient, and then practicing them and keeping them fresh in your mind, that's really how you get good. So this is obviously a really high risk territory. So you take the fact that EKGs are hard, you take the fact that you may not be doing them every day, and then you take the fact that like there's all these little nuances that are so subtle that have big risk involved, and you come up with a recipe for disaster. So what we need to do is we need to get good, and we need to do it quickly. So the other thing I want to just caution you about is that my strategy, and I don't know if you are like this too, okay? So my strategy was, you know what? Computers are smart. And, if computers are smart, then I'm going to listen to the computer software interpretation because clearly that's going to be the most correct thing. Well, it turns out that that strategy was also wrong. In fact, the machine is only correct about 6 to 42% of the time, according to most studies. So with that being said, that is unfortunately not a good number for us. We have a 0% miss rate. Okay, so the strategy is we actually have to know the patterns. So let's go back to the foundations, and let's just go back to the 10,000 foot view and see if we can look up, really up high in the sky, and then we'll kind of come down into the more nitty gritty stuff. So first of all, the questions we're asking about the EKG. This is a really interesting concept because if you think about this flat piece of paper, it can tell us about if the arteries are blocked, if the conduction is intact, and how big are the walls? Is there ventricular hypertrophy? You can also tell if there's any fluid surrounding the heart. So what would you potentially see on the EKG if there was fluid surrounding the heart? And you can also tell, and type that in the chat for me if you feel brave. You can also tell if the heart lining is inflamed, AKA pericarditis. And Jen says, I admit I trusted the computer too much. We all did. You're not alone, Jen. I was there too. I think we all do, right? But then we learn, right? Then we learn. So how do we see if there's fluid surrounding the heart? Well, one of the ways is you might see decreased QRS sizes, so decreased voltage. So the decreased voltage will show up. So small QRS waves are complexes, and I'll show you what those look like. And yes, Brandy, good job, low voltage, okay? And we see pericarditis by looking at how much ST elevation is around and is it reciprocal, okay? So inflammation of the pericardium causes widespread ST elevation. Yes, Kara says low voltage, exactly. And then here's another concept that is really important to understand. And this is something you can use with your patients if you want to. This is the speech I give them when they come in and they have, let's say, chest pain and palpitations. They'll say, oh, I have all these things. And I'll say, okay, well, we're going to do a stress test. We're going to do a Holter monitor, and we're going to do an echocardiogram. And they're like, wait, I only have one heart. Why do you need Why do you need to do 3 tests? That just doesn't seem necessary. I can see their point. It does seem a little excessive. So this is the speech I give them that convinces them to let me do the test that I need to do. So I say to them, hey, listen, your heart is just like a house and you have plumbing in your house. That's the vessels. We only see that with a treadmill, right? Oh, hey, DeMark's joining us. And the next thing is that you also have electricity, right? You have plugs in the wall, and that's just like the conduction that's in the heart. Okay, same thing. We measure that with an EKG or a Holter monitor. The other thing is we need to look at the walls of your heart, right? So the walls are the muscle, and that I can't see on a treadmill. I can see that on an echocardiogram though, and I can see if they're moving appropriately. And I can also see the doors on the echocardiogram. And the doors are the valves. So once you explain it to them that way, they totally understand. So let's get down to the nitty gritty now that we have the foundations set basically. And let's talk about these waves, okay? So let's talk about the first wave, the first upright wave that is smooth and not notched. This here, anybody want to type in the chat what this wave is here? It represents atrial depolarization, okay? And this is, we've got a lot of people saying it, yes. Oh, all right, excellent. Everybody on Zoom is getting it right. This is the P wave, most excellent, okay? The next wave we have here is a downward or negative deflection. This is called a, let's type that in the chat. What wave is that? Go ahead and type that in. Oh, look at you, yes. Chris, I'm so glad you made it. Heidi's on, Brandy's here. It is Brandy, yay. Megan, everybody got that right, good job. And then the next one up, what is this wave called here? What is this wave called? This represents the ventricles depolarizing. And yes, this is the R wave. Good, this is the R, excellent, excellent, excellent. You guys are doing great. And then coming on down here, the last part of this wave is called the S wave. Yes, you guys don't waste your time, I love it. And then this wave right here is called the, what's this wave called? Yes, the T wave, strong work. And the last wave here, this is called the U wave. Good, Heidi, Megan, Kara, Stephanie, nice job, ladies, nice job. It's ladies' night, I think. Okay, so good. Now we've identified those, I'm gonna give you a couple rules that are good to remember, okay? So when you have a P wave, it'll be a positive deflection, especially if it's in lead 2, and we don't want it to be notched. We also don't want it to be too close to the QRS. The next thing is the QRS, right? We don't want it to be too tall or too wide. If it's too tall, what do we potentially think about? If the R wave is too big, what condition do we potentially think about? So type that in the chat if you know. And if you don't, I'll tell you, it's totally okay. And then, oh good, Brandy, yes, left ventricular hypertrophy. Nice job, everybody, Brandy and Wendy, excellent. So a big R wave could mean they have a big ventricle, okay? That's awesome, nice job, Carrie. And then the last wave here that you're supposed to see is the T wave. It should be upright, and we don't ever want our T wave pointy. If our T wave is pointy, what condition do we worry about? If our T wave is pointy, what do you guys think? If the T wave is pointy, yes, good. Kara and Brandy and Diana and Wendy, hyperkalemia, sweet, okay? And then over here, this is a U wave. Sometimes we'll see this with some sort of potassium disorder. Is it a low or is it a high potassium that can cause the U wave? What do you guys think? And meanwhile, let's move on to the paper, okay? Meanwhile, we'll move on to the paper. And if you don't know the answer to that U wave, will be coming back to that in the workbook, so don't worry. Diana, I like your question mark. Yes, you are right. So let's talk about the time. So I kind of hand sketched this. You can see my writing. I tried taking a piece of paper at work and just coloring the one small box, which represents 0.04 seconds, okay? And then 5 small boxes is 0.20 seconds. So this is kind of how we calculate time. And what's super important to know, you say that too? Awesome, awesome, awesome. I'm so happy. So the important number to know is 3 small boxes, because 3 small boxes is how wide the QRS should be. Under that, if it's over that, it's too wide. So knowing the box size is important. And then the other thing that's important when you start to calculate rate is being able to identify the thick lines, which I drew on here for you guys to see. The thick lines are something we use when we use that 300 rule when we're counting rates. So being able to identify the thicker lines, and Tori just said, yes, 3 boxes for the QRS. I love it. So under 3 boxes is the key. Okay, so here's a little bit better picture, just showing you what we just talked about, right? This one small box is 0.04, 5 of them is 0.20. And then you also measure voltage. And so when we start calculating things like LVH or a right ventricle, we would use the voltage side of this. And that's just basically what we're doing. Okay, so keeping it simple, we're going to just go back really quick. And I'm going to tell you a little story about these waves so that you can remember their situation. So I like to think of the P as the mom, the QRS as the dad, and then the T wave as the baby. And they all should be holding hands and marching along the EKG together. And the key is that you don't want the mom to be too close to the dad, and you don't want the baby to be going too far away from his dad. You want him to be nice and close and snug, because if he starts to run away and goes closer to the next mom, then you have to worry about prolonged QT, okay? And so you never want the baby running towards the next mom. Now, the other thing about this is a great graphic that shows you the PR. Actually, this could be a little bit longer, the PR, the QRS, and then the QT measured here. Okay, so this is just showing you the segments. We talked about the waves, and these are the segments. Okay, and one other thing I want to point out while we're here is this here is the ST segment. And this is something that we're going to use to look for any elevation or depression, because that's how we start to look for ischemia in the ST segment. Okay, so hopefully this is making sense, knocking some cobwebs off. And again, just going back to the P, remembering it's the first positive deflection, and we really don't want it to be notched. So when the sinus node fires, it's going to make a P wave. And the way I remember that is sinus makes P. Sinus makes P. And a sinus, if you have a P wave, that means most likely the sinus node is in charge. Oh, yay, Tori, you just put it all in for us. I love it. And so this is the ventricle, or sorry, the atria depolarizing. And then this is the ventricles depolarizing. Okay, so you don't want the P too big, because that could mean the atria is enlarged as well. And you don't want it notched. Okay. All right. So the PR interval, right? We talked about that a lot. P to R interval, it should be between 100 and 200 milliseconds. I would write that down. We're going to be seeing that again in our workbook. Hint, hint. We want to know the duration, right? Should be 120 to 200. So when we talk about first degree heart blocks, which a lot of you guys mentioned, hey, heart blocks, heart blocks. So first degree heart block has to do with a lengthening over 200 milliseconds of the PR interval. Okay. And then talking about waves, it would behoove us to visit the delta wave as well. This is not a wave that we normally talk about, but when we talk about Wolff-Parkinson's White, this is something that we look for. We look for a slurred upstroke, okay? A slurred upstroke of the QRS complex. Now, if you look over here, this is nice and tight and not slurred versus this one, which is slurred and wide. So the difference between this is wide and slurred and not sharp like this. And so if you see that, that's called a delta wave. Just throwing it in the bucket of waves that we're talking about tonight. Now, speaking of other waves we should have on our radar, we should talk about the Q wave. And the Q wave is the first negative deflection after the P wave, the first negative. That's also going to be on our workbook, by the way. First negative, okay? And in order to know if a Q wave is bad, in order to know that, we need to do a couple calculations. Now, I want to ask you, what did you get taught that Q waves mean? If you see a Q wave, what does a Q wave mean? What have you guys been told? If you see a Q wave, it means they have had a what? I know you guys have been taught this. An MI, an old MI, absolutely. Good job, okay? And that's true most of the time. It's not always true, but yes, most of the time. And the reason why I say most of the time is because sometimes people can have new infarctions and Q waves can develop within an hour of an infarction. So even though we are taught, like everybody's saying on Zoom and Facebook, that it's an old MI, these can develop within an hour of an MI. So we should not say old all the time until we can prove it. Okay, so always consider these new until proven otherwise. That's why the machine says MI of unknown age when these come up. That's kind of the clue. It'll say MI of unknown age. Okay, so in order to know if they're pathologic, they are deep or more than 1/3 the height of the R wave. You can see this is the R from here to here. If you were to chop it up into thirds, this Q wave is 1/3 the height of the R wave. And then you've got this one over here, which is wide, okay, more than 30 milliseconds. So deep, more than 1/3, or more than 30 milliseconds are bad, okay, in the Q wave land. And then here's an example of an EKG in the wild, so to speak. And you can see that 2, 3, and AVF have some cues. And what I just wanted to kind of point out for us here is that here you can see the Q wave here. Okay, it's a negative deflection. You can see a tiny one here, a tiny one here. So they are contiguous, meaning with the same artery. These are fed by the same artery. And if you were to really measure this, then you would know, yeah, this is 1/3 the height. So these would be considered pathologic. So just a little example of what that looks like in real life. So then the next thing we want to talk about is the QRS, remembering it shouldn't be wider than 3 small boxes, representing the ventricles depolarizing. And then lastly is the T. Now the T wave deserves a little bit of conversation, and we're almost done with our lecture portion. We're almost about ready to go into breakout sessions, which reminds me, if you're on Facebook Live but not on Zoom, either Michelle or Tori or Ruben will drop the link for the Zoom so you can hop on, because we're going to stop streaming into Facebook when we go into the breakout sessions so that we can make sure to be able to interact with you guys. So the T wave, okay, it should be a little imperfect. Can you see this T wave that is very imperfect here? It's a little lopsided. Now we tend to think that all the waves should be perfect, like this model here. Potentially, she may be the idea of perfection. She sure is beautiful. But at the end of the day, and thank you, Tori and Michelle and Ruben for posting the Zoom, but this T wave is a little lopsided. And that's the way we like them. And I'm just going to draw a line down the middle because I really want this to hit home with you guys. This T wave, okay, there's more on one side than there is on the other. And that makes it a little asymmetric. And that is what is normal. Next time you go look at your T wave on a real EKG, you'll notice, you'll be like, oh, wow, that's pretty cool. And at the end of the day, asymmetry is what we want to see. We don't want to see symmetry in a T wave, okay? Now there's many problems you can have. We won't obviously cover all of them tonight because there's so many. Hi, Annie. Annie's on with us. So they can be biphasic, which means up and down. They can be upside down, which means inverted. They can be, and that's actually an example right here. You can see some inverted symmetric on this EKG right here. They can be really big, for example, concerning for hyperkalemia. They can be really small. They can be flat, hypokalemia, or they can be peaked, hyperkalemia. And there's lots of examples of bad T wave problems, but I'm going to show you just 2 little examples before we break into the breakouts. So this is an example of an EKG where we had an abnormal T wave. Now, one thing I didn't cover, and I'll cover real quick because it's going to be in your workbook as well, so you have the answer, is that the T waves, this is the rule, okay? T waves should be upright in all leads except for AVR and V1. Okay, so AVR and V1, I would write that down. I guarantee you we'll be talking about that again. Okay, so AVR and V1's T waves should be pointing down. These T waves are clearly not pointing down. Okay, so there's some problems happening here. And the other rule is that every other T wave on the EKG should be pointing up. Every T wave on the EKG should be pointing up, except for AVR and V1. And Tori's putting that in for you, writing it. Thank you, Tori. So really at the end of the day, you're seeing this and you're like, oh yeah, this is really abnormal. The T waves are not following the rules. Now, what does that mean is a whole different story, but I just wanted to make sure you could identify it when you see it. Okay, so problem T waves These are problems. They are not pointing the right direction. They're also symmetric. And remember, symmetry in a T wave is never good. Okay. And you can see that those are symmetric, they're deep, and we don't like those. Okay. And then this is one of our last EKGs to share with you before we go into breakout. This one right here is someone, if someone handed you this EKG, tell me in the chat, what would you say to them? If they handed you this EKG, what would you say to them? Okay, so you'd say repeat. Brandy, you're so smart. Brandy, yes, repeat, absolutely, because there's too much artifact, okay? And don't be shy. RJ would be like, I don't like it. But at the end of the day, don't be shy, get another one, because if you can't see if there's AFib, right? Or you can't see if there's ST elevation somewhere, it's not a good enough tracing. Get another, Leslie says. Yes, absolutely. So a couple of things you can see is, because we're talking about it, let's just go visit those T waves. The T waves are, if you can see here, how would you describe them? The ones you can see, what is going on with them? What is the descriptor word that we would use for the T waves that we can see? So we have tall, excellent. We have peaked, excellent. Tall and tented, yeah, those are good. I like these. Peaked and wide. Okay, these are all good descriptor words, and they are. And so if this person missed their dialysis, not that we're talking about treatment, but what would you suspect with tall, tented T's and missing your dialysis? Yes, good, hyperkalemia. You guys are all on top of that. Nice, okay? So absolutely, we would expect hyperkalemia. And that is why this patient's EKG was so wonky. They were actually starting to have really bad hyperkalemia, which is why the QRS widened as well. Very good. Yes, Bria. Yes, hi, Bria. Yes, awesome. Okay, so now what we're going to do is we're going to have you guys gather up your workbooks. Again, if you need the workbook, please type now workbook. We'll send that to you because I need you to have the workbook, because we're going to go over this and a few bonus EKGs in our breakout session. Okay, so when we're done with this, what we're going to do is actually, let me see if I can stop the share. Let's see if I can stop it. Okay, good. Yeah, I'm going to stop the share. What we're going to do is we're going to take our workbooks and we're going to go into the breakout sessions. Half of you will be with me, and then half of you will be with Michelle. We'll randomly assign you, and then we'll come back in and we'll do a final wrap up. And when we do the wrap up, we will actually go ahead and answer any questions and do some final thoughts. And we'll spend about 20 minutes or so in the breakout sessions. Now, one thing I want to say before we go ahead and go into the breakout sessions. So if you're on Facebook, hop into Zoom with us. The one thing I want to tell you is that it's not going to be recorded. It's just us on the breakouts. And so you don't have to worry. You can ask the questions that you want to ask. But know that really at the end of the day, we just want you to be yourself. There's no pressure. If you don't want to be on camera, you don't have to. If you don't want to answer, you don't have to. This is for you, by you. So if you want to, we would love you to. So I'm going to stop the stream in Facebook. So for Facebook people, hop into Zoom. Hopefully we'll see you on Zoom, and we're about to go into breakout sessions. Okay. All right. Oh, I think we're streaming on Facebook again somehow. That's weird.
Oh, okay.
Anyway, okay.
I didn't turn Facebook back on.
I didn't either, but that's okay. People can hop on. We're not talking about anything secret now. So I hope you guys liked the chance to be a little bit more anonymous and interact with us. And we're going to do this again the next 2 nights. So thank you for being patient with the bumps in the road, getting you to the rooms. We will be a little more eloquent tomorrow night, I promise. But hopefully you enjoyed it. We'll be doing the workbook page 3 and 4, and we'll be doing some arrhythmias. And Wendy, I know you had a work issue. So every night is recorded except for the breakout sessions, because it doesn't allow us to record those. So, but the main session will be recorded, Wendy. So don't even sweat about that. So anybody else have any questions that you guys wanted to fire out real quick before we wrap up the night? I do want to give you a chance to win the prize tonight. I want to show you what the prize is. So the prize we're going to be giving away, hopefully you guys can see me, is actually, yeah, Muna knows what this is. We're going to be giving away we're going to be giving away this box. So normally we give it away on the night of the drawing, but we're going to actually do this tomorrow at the beginning of our session. We're going to give this away. So it's in,
I get this.
oh, look at Mona's showing hers. Oh, Valeria. Okay.
And it's
Oh, that's so
really
cute.
great.
So Michelle, can you do you have the answers written down for the workbook?
Yes, I do.
Are you able to like send those to me? Because I can scan them in, because I think a couple people in my group didn't get all the answers.
Oh, okay. They're messy in my handwriting, but I will type them up.
Yeah.
Yeah.
No, Noelle wants that too. Yeah, everybody wants the answers. So
Yes.
we'll get those for you guys. Thank you for letting us know what you need. Okay, so we're going to give this prize away tomorrow, but what I need you to do is put hashtag EKG Launchpad if you want to win this. Okay, now if you're in the 30-day EKG challenge with us, you don't need to win this. But if you already have this, but otherwise, if you aren't and you want to win this, there's a couple cool things in this box. Okay, so probably my favorite part is that we'll be giving away a painting. Okay, so a little mini painting, right, with a little easel. We'll be giving you a set of crayons so that you too can color code your EKGs. We're going to be giving away this beautiful little tool. The remember how I talked about
Wow.
I know, Mona.
Wow.
Luna
I
knows.
want this. I want this.
Luna, where you been all my life? Okay, and then we also have the EKG workbook where it has 17 real EKGs that we'll be working on together. And then there's a couple cheat sheets in here as well that I won't show you because I don't want to give away all my secret sauce. But this we're going to give away tomorrow at the beginning of our session. So come to the session. I now have all your names. What I do is I take them and I write them down in little paper. I have fun EKG paper to write your names on. And we'll draw the winner tomorrow. And of course, we'll have more prizes. So got your names. Any final questions before we break for the night? Otherwise, we'll see you tomorrow at 5:30 PST. Okay, awesome. Michelle, I want to say a big thank you to you. You're wonderful. And Tori for being here also. And everybody who showed up live, so much gratitude for you being here. And also for you cheering the other people on who came. I appreciate that. All right, we'll see you guys tomorrow.
Thanks, guys.
Thank you so
Thank
much.
you.
Bye.
Bye.
Thank you both.
No problem.